What we see with coronavirus is people usually have fever and what's called lower respiratory symptoms, so difficulty with breathing or cough. The issue is most people are going to feel sick but can be fine at home. The issue is when do they get severe enough that they have difficulty breathing and then they need to go to the hospital or someplace where they can get oxygen or get support in that way. And so we want to make sure that the spread is slow enough that we are not having so many folks that have severe forms of the virus need our medical system all at once. Those that are at higher risk of getting the severe part of the illness are people who are above the age of 65 or have underlying medical conditions like heart disease, lung disease, a weakened immune system, diabetes. So what we're saying, it's not more catching to those people, but if they do get sick, it is more likely that they will get a severe version of what we are seeing. We think other adults will get this and then they'll be fine, and we don't really know. We can't say with certainty, this is how you are going to react, this is how another is going to react, and so we can say, oh, you're high risk, make good decisions. And so we want to give people the best information we can, and then they have to make their own decisions. I think talking about it with their doctor is a good idea to say, do you think I'm at high risk? What I would also say in terms of high risk of contact, in terms of being in proximity with someone who has had COVID-19 or has COVID-19, the CDC is defining high risk as someone who might be a household contact, meaning living with someone with COVID-19. They call medium risk someone who may be within 3 to 6 feet of someone who has been or found positive, and they're with them for more than 10 minutes. So for a prolonged period of time, in a close distance, that's a medium risk. What they're calling low risk is, say, walking through the grocery store aisle or walking through an airport. Those are lower risk. Now, you're not hearing me say no risk, which is, again, why we go back to the wash your hands, so, use good judgment, wipe down surfaces, because there's no guarantees here of no risk. And I think that's why people just need to figure out for themselves, do I fall in a high risk category? Have I had a high risk exposure? How do I make sure that I'm as safe as possible and keep myself in low risk situations?